The doctor is in, and today it's Pediatrician Dr. Courtney Sauls from Ascension St. John Pediatric and Adolescent Medicine. Now, coughs and colds are running rampant across everywhere right now, so we're talking about how to provide supportive care to sick kids. Dr. Sauls, thanks you for being here as always.
Yeah, happy to be here.
So what can we do and what remedies do we have here?
Yeah, so there are a lot of things that families can do at home to help their children get over coughs and colds. A lot of things maybe you wouldn't think of that are really effective. So I've brought today with me a lot of props. These are all my things from home that I use for my own kids that I thought I would share with families. So one of the best things for coughs, which maybe you might not think, is actually honey. You'll want to use this for your children that are over 1 year of age. Just like even a teaspoon or a quarter teaspoon for children, just straight honey. Even can mix it in some hot tea or hot water with a little bit of lemon, and that can really help your coughs and your sore throats for older children above 1. A couple of other things for your little babies are going to be clearing their nose out. So babies get miserable when they have stuffy noses and they don't know how to get their boogers out
Lots of
like
crying.
we do. Exactly. And so really your best thing is going to be this nose Frida. If you've never heard of it before, it is a nose sucker that you suck on the hose yourself and get the boogers out. It sounds crazy, but it is so good. You're going to want to get some nasal saline and squirt that in your baby's nose first, followed by the suction that you do. And you know what? Any old saline will do. You don't have to get the baby brand. Even the regular adult brand that is just an off brand of nasal saline is going to work totally fine. So get the cheap stuff.
All kinds of stuff over here.
Yeah, and I got a couple more things too. So I like chest rub for a baby, so above 2 months of age is really good to help with cough. This all natural Zarbee's brand is really good. And then I brought my child's humidifier with me. You can run a cool mist humidifier by the bedside at night. That will really help kind of loosen things up in their nose and help moisten all those boogers. And then a cool mist humidifier is going to be the best. A hot mist humidifier can have a risk for burns, and all that heat can cause issues too.
So what's this over here?
Yeah, so this is an electronic nose sucker.
Okay.
So if you're like maybe averse to doing one like this electronic one might help you get through that a little bit better. I still don't think it's quite as effective as the one that you can suck on yourself. So, but this electronic one is a cheap one that I got on Amazon. You don't have to get a very expensive one. Even the blue bulb sucker that parents will get from the hospital when they have their new babies, that one will do if that's all you have as well. And then of course, I've brought some Tylenol and ibuprofen. These are kind of hard to come by at the store right now. But even the off-brand acetaminophen for Tylenol, ibuprofen for Motrin will do just fine for children as well.
Just real quickly before we go here, you know, if they're coughing, having those issues, when do they know they need to take the child in to see a doctor?
Yeah, so you're going to want to look for really fast and rapid breathing or dehydration. Those are going to be your biggest things. So in a smaller baby, if they're breathing more than 70 breaths in 1 minute, really using those extra muscles to take deep breaths, the outsides of their nose are flaring in and out and they're grunting while breathing, that's working too hard, or I'd want their oxygen to be checked and them to see their doctor. And then also we want babies to be eating well enough to stay hydrated. So that's 3 wet diapers in 24 hours is going to be your key to making sure a young child's staying hydrated.
Awesome. Well, thank you, Dr. Sauls, as
You're
always,
welcome.
for being here.